Recently, a viewer asked me if statins could lead to nerve damage that would cause ALS. So today we're going to take a look at that and Parkinson's disease. Stay tuned. So as usual, I consulted a lot of sources, and here they are. The 6 top ones are on Parkinson's disease. The next 4 are on ALS. And then the bottom 2 are actually on peripheral neuropathy, which I just wanted to make a connection there. I'm not going to just go over statistics and say this study showed that it increased Parkinson's disease by this percent or ALS by this percent, and this one showed that it decreased it by this percent or whatever, because this would just be a very bad sequel to my prior video on colitis and glaucoma. This time I'm going to do something a little different. I'm going to actually try taking a little bit of a look at the mechanisms by which statins could affect these things. So we'll look at Parkinson's disease first. And this first paper, which is the one that was entitled Pros and Cons for Statin Use and Risk of Parkinson's Disease, it was an updated perspective, so it was a review article. And they cited 11 studies, and out of these studies, we got various mentions of the mechanisms. The protective effects of statins could be by different mechanisms, including anti-inflammatory and antioxidant effects. Yeah, a lot of doctors actually do say that statins provide an anti-inflammatory effect. Statins improve the regeneration of the neurons and upregulate dopamine transporters. The study indicated that only long-term statin therapy is effective against the development and progression of Parkinson's disease, or these findings suggest a protective role for statins against Parkinson's disease risk. On the flip side, in the same article, under the heading Harmful Roles of Statins in Parkinson's Disease, they cited 8 studies. Now, we're not going to just say, oh, it's 11 to 8, the protective role wins. That's not how it works, but we'll just look at what they had to say here. Statin therapy may be associated with higher risk for development of Parkinson's disease based on cholesterol has a neuroprotective effect against the development of NBDs. NBDs are neurodegenerative brain diseases. The findings suggest that statins had detrimental effects on the expression of dopamine transporters in a part of the brain. Notoriously, hydrophilic statins, that would be like Crestor, are linked with the rapid progression of Parkinson's disease. Finally, these observations suggest that statin therapy for primary and secondary prevention of cardiovascular diseases may increase Parkinson's disease risk by different mechanisms, including reduction of CoQ10. What you should notice about these statements is they're all conditional. Protective effect of statins could be. The study indicated. These findings suggest statin therapy may be associated with. They're linked with the rapid progression, or they suggest the statin therapy for primary or secondary prevention, etc. So what they're doing is they're offering hypotheses, which tells me that at least in this paper, they weren't able to find anything definitive on what the mechanisms may be. That's what needs more study. So let's just move on ahead, and we're going to look at the 6 papers that I consulted on Parkinson's disease and just their conclusions. This paper, number 1, I've been reviewing. They basically say that taken together, according to recent and updated studies, there's controversial points. You kind of get that from the fact that there's the protective and there's the harmful aspects in the same article. Number 2, but don't ask your doctor for a prescription just yet. Statins, like all medications, have potential side effects, and more work is needed. This is actually from the Michael J. Fox Foundation. Michael J. Fox is an actor who is an advocate for Parkinson's disease treatment. He has it himself. Paper number 3, in conclusion, the present study demonstrated that statins may have a deleterious effect and affect the long-term outcomes in patients with Parkinson's disease. Until higher quality evidence is available, statins should only be prescribed for their original purpose. They should not be repurposed for Parkinson's disease risk reduction. Paper number 5, these results, talking about involving statins, are disappointing, but mean we can now move on to focus on other promising opportunities. So this particular paper has actually given up on statins at all, and that is, by the way, Parkinson's UK. And finally, we're not saying that statins cause Parkinson's disease, but rather that our study suggests that statins should not be used based on the idea that they will protect against Parkinson's. But if you read the article, they were kind of implying that statins could cause it. So now let's look at the viewer question on ALS. ALS is amyotrophic lateral sclerosis. And John had asked, is it possible that taking statins for 10 years can cause nerve damage that leads to ALS? Okay, so I think that was a great question. We've looked into it. So first, here's from article number 7. The doctor states that there's no good evidence that statins cause or trigger ALS. There have been reports of people who have developed ALS while taking statins. Well, I suppose there's people who develop ALS while not taking statins also. Other studies have shown a decreased risk of ALS in people who take statins. Okay, so that's this doctor's position. And then he goes on to say, statins can sometimes cause muscle pain. That's myalgia. We talk about that all the time. Muscle weakness, or very rarely severe muscle damage, rhabdomyolysis. And these are generally grouped together as SAMs, or statin-associated muscle symptoms. symptoms. He goes on to say, but these occur as a result of direct muscle damage, not damage to nerve cells. So the connection being made here is that SAMS is not related to ALS type symptoms. The vectors are totally different. The SAMS, the standard kind of muscle symptoms that we may get, that's actual damage to muscles, whereas ALS is damage to nerves in the brain that control the muscle. So in that sense, they're not related. Now, what he didn't say is he didn't address peripheral neuropathy here, and it probably just wasn't pertinent to the discussion in this very short paper, but I'm going to actually address any potential connection in a moment. So the next paper, paper number 8, where they said additionally, they referred to a couple studies by other people, indicated that increased serum lipid level was a neuroprotective factor in ALS patients. And I think that's very interesting that serum lipid level was protective, because that means your blood lipid level, but ALS is a disease of neurons in the brain. But in any case, their conclusion was physicians were recommended to exercise caution when prescribing statins in patients with ALS. Another paper, given the overwhelmingly safe profile of statins, and that this particular drug that I'm not going to try to pronounce is the only FDA-approved medication found to extend survival with ALS, and only modestly, additional investigation of a potential therapeutic benefit of statins in other cohorts, preclinical studies, etc., would be warranted. I don't even know what to do with this. Well, first of all, I want to point out a little bit of propaganda that's been slipped in there on us. They do this all the time. They'll make these statements, and the one I'm referring to is that first phrase, given the overwhelmingly safe profile of statins. They're trying to slip one by us on that, because we all know that statins are not overwhelmingly safe. You notice that the previous quote actually warned against treating people with ALS with statins. The implication there was using even statins for their intended purpose. This paper is saying, well, maybe we should investigate to see if they can help people with ALS. So that gets us back to that whole debacle about trying to treat off-label conditions with statins for some minor potential benefit and just as much potential harm. So what's my conclusion? Well, on Parkinson's, here's a description of how Parkinson's disease is developed. Those phrases in the blue are structures within the brain. And then they go on to say these changes promote the development of motor dysfunctions, including rigidity, resting tremors, and bradykinesia. I think we can imagine what rigidity is, resting tremors are. Bradykinesia, let's break that down a little. Brady means slow, as in bradycardia, slow heartbeat, and kinesia is motion. So like the slower motions of somebody who's got Parkinson's disease, or the reaction of their muscles to their attempts to move them. And then this paper, this is paper number 1, by the way. Besides, numerous non-motor disorders are present, including apathy, depression, anxiety, etc., etc. You can see them here. The ones that I've highlighted in red are the ones that I don't have Parkinson's disease, but I actually experienced these sorts of adverse effects while I was on statins. Is there a connection between this? Was I headed towards actual Parkinson's disease? I don't know. I can't draw that line. It's just worrisome that a lot of the adverse effects of statins do mimic Parkinson's disease. I'll call them secondary effects. So my personal opinion, it's non-medical, but it's my personal opinion and my decision. If I had Parkinson's disease, I would stay far away from statins just for that reason alone, just having Parkinson's disease. And as someone who, while on statins, experienced these non-motor disorders often seen in Parkinson's patients, just another reason I'm just going to avoid statins. Cognitive dysfunction, those neuropsychiatric disorders like anger outbursts, that sort of thing. So my conclusion on ALS is a disease of damaged nerves in the brain and the spinal cord. Statins damage those brain and spinal cord nerves, then there could be a connection between statins and the development of ALS. I don't happen to know that that's been shown to occur, but it's certainly conceivable given how little we know about how the brain is affected by statins. So let's see if there's a connection with peripheral neuropathy, because I mentioned that earlier. Well, that results from damage to the peripheral nerves. In other words, the nerves at the site of the body part, feet, hands, toes, fingers, in my case, my knees. It's nerve damage there, so it's not from nerve damage to the structures in the brain. So it's hard to draw a connection between peripheral neuropathy, which as you can see here is 14 times more likely to develop in somebody taking statins than not. I mean, that's a relative risk increase. This is just an outstanding statistic. That just baffles me that peripheral neuropathy is not much better known, given a figure like 14 times more likely to develop. But in any case, we can't actually draw a line from peripheral neuropathy to ALS for the same reason that we can't draw a line directly from muscle damage to ALS, because ALS really isn't muscle damage, it's neuron damage in the brain that controls the muscles. The two things are very different. So my personal opinion, well, given that the effects of statins on brain function is not well understood, it wouldn't surprise me to learn that ALS can develop from statin use. I have had peripheral neuropathy from statins. I don't believe that that's actually an indicator of the probable development of ALS from statins. The two are kind of too independent. It's kind of like when I had transient global amnesia event that I've covered in another video. When I went to the neurologist afterward, he said, here's the good news. This doesn't increase your chances of having a stroke. And then he kind of added in, the bad news is it's got nothing to do with it. It doesn't mean you're less likely to have a stroke. It's just an independent factor. Well, I think it's the same thing here between peripheral neuropathy and ALS. So that's my take on that. That's what I've got on Parkinson's disease and ALS and their relationship to statin. It's not really a hard and fast connection, but there could be a connection there. In both cases, I think it's very likely that there's a connection with Parkinson's disease. I believe that it's a danger to anybody with ALS to be taking statins. At least that's what the papers tell me. So if you appreciate this content, please like, share, subscribe, and comment on this topic or others you'd like me to cover. And if you haven't seen this video, I recommend you take a look at it now. Thanks for listening.